If you're watching this and you're over 70 or you care about someone who is, pause whatever you're doing. What you're about to learn could mean the difference between living independently into your 90s or facing health challenges that could have been prevented with just a few minutes a day. This isn't clickbait. This is elder care, straight talk, and life-saving advice from a doctor who's worked with aging patients for over 35 years. And it starts with something so simple, so basic that we've learned to overlook it. Washing 6 critical, often neglected parts of your body. Every single day. Let me take you back to a patient I'll never forget. Her name was Gloria. She was 87, proud, sharp-minded, lived alone, and still cooked 3 meals a day. But when she visited my clinic, she wasn't herself. Her balance was off, and there was a subtle, persistent odor. Nothing that screamed emergency, but something was off. What we found shocked even her. A deep skin infection between her toes had been brewing for weeks. Why? Because she thought it was just a little irritation. But that little irritation was a fungal infection that had turned into cellulitis. She spent 19 days in the hospital and almost didn't make it back home. This, my friends, is why we're here. This is why I need you to watch this video till the end. Because you can prevent what happened to Gloria. Not with expensive medication. Not with complex treatments. But with warm water, a clean cloth, and 5 to 10 minutes of daily intention. No matter your age, no matter your mobility level, you can start this today. The first body part that deserves more attention, your face. Especially around the nose, eyes, and mouth. As we age, the skin becomes thinner and immune defenses around mucous membranes weaken. But it's not just about skin. Gently washing your face daily using soft circular motions with lukewarm water stimulates nerve endings, improves circulation to the brain, and can actually help sharpen cognitive function. I've seen patients with mild cognitive decline feel calmer and more oriented when this becomes a daily ritual. Combine it with deep breathing and you're giving your nervous system a reset. This is not vanity. It's vitality. Next, let's go behind the ears. The spot everyone forgets. But did you know this area traps sweat, oil, and dead skin faster than most parts of the body, especially if you wear glasses, hearing aids, or oxygen tubes? I've treated dozens of older adults with infections that started here. Simple ones that turned into painful abscesses. Why? Because it's warm, dark, and moist. Bacteria love it. But here's the truth. Clean this area gently once a day with a warm cloth. Pat it dry. Let it breathe. It's that simple. Now the neck. A vital yet neglected part of your body. It's not just skin, it's blood vessels, lymphatic pathways, and posture support. When you gently wash your neck, you're not just removing sweat. You're stimulating circulation to the brain. You're also preventing irritation, which in elderly skin can quickly lead to rashes or even secondary infections. I once treated a man in his 90s who had limited mobility. His caregiver never washed his neck, assuming it wasn't needed. What developed was a patch of red skin that spread to his shoulders and chest. A daily wash might have saved him weeks of antibiotics and discomfort. Now on to the underarms. Yes, for odor, but more importantly for lymphatic drainage. Your underarms contain lymph nodes that process toxins. When they're clean, they do their job better. But when clogged with sweat and dirt, those toxins stay longer in your system. If you wear synthetic fabrics or have limited movement, this becomes even more critical. I had a patient, 79, former dancer, who kept developing low-grade fevers. No clear reason. Until we noticed the swollen lymph nodes. Daily gentle cleansing, breathable clothing, and warm compresses turned her situation around. Let's talk hands. You touch doorknobs, money, mobile phones, and food. And yet many older adults only wash hands after using the bathroom. But what about before meals? After handling medications? Or after scratching an itch? The hands are your main tools. And under those nails? A world of bacteria waiting to be transferred. I teach my patients to treat hand washing like a mindfulness ritual. Feel the water, breathe, clean every finger, and finish by gently massaging the fingertips. It's not just hygiene, it's a moment of connection with your body. And now, the most important of them all, the feet and between the toes. This is where it often begins and sometimes where it ends, sadly. Your feet carry your entire life. But many older adults ignore them. They're far away. Hard to reach. Out of sight, out of mind. But the consequences? Fungal infections. Cracks that become ulcers. Especially if you have diabetes or poor circulation. I've seen too many people lose toes or legs all because no one was checking between their toes. Here's what you do. Soak your feet in warm water once or twice a week. Use a soft cloth to wash between the toes daily. Dry them completely. Moisturize the heels and soles. Use a mirror if needed. Ask for help if you can't bend. This isn't luxury, it's survival. What all these practices have in common is simple. They keep your immune system strong, your skin barrier intact, and your body in a state of daily self-respect. Because here's the truth. Aging with dignity isn't about avoiding wrinkles. It's about staying clean, confident, and independent. And these 6 areas, the face, behind the ears, the neck, underarms, hands, and feet, are where infections start and where prevention is most powerful. If you've stayed with me this far, I know one thing: you care. And that means you can make a change starting tonight. Choose 2 of these body parts. Go to the bathroom. Get a clean cloth. Warm water. No rush. No scrubbing. Just attention. Just presence. Just care. Do it again tomorrow. Add 1 more. Within a week, all 6 will become part of your daily rhythm. You'll walk with more stability. You'll sleep better. You'll smell better. You'll feel more alive. Not because a doctor said so, but because your body will show you. This is Dr. Rao, your companion in healthy aging. I've seen what happens when people give up. I've also seen the miraculous results when they start again. Share this video. Share this knowledge. It may not go viral, but it might save a life. Start with water. Start with your hands. And never, ever forget between the toes. There's more to come. In the next part, we'll explore 5 key nutrients that keep your muscles, memory, and mood strong well into your 80s and 90s. But first, go wash up. Life is waiting. Stay clean. Stay kind. Stay alive. So there you have it, 6 small places that make a big difference. It doesn't take hours. It doesn't take fancy products. Just a little time, a little care, and a choice to treat your body like it matters, because it does. If you're over 70, or if you love someone who is, remember this: prevention starts in the bathroom, not the ER. These daily acts of hygiene are acts of strength. They protect independence, comfort, and peace of mind. Start today. Just pick one area. Maybe your face, maybe your feet. Be gentle. Be present. This is more than cleaning, it's connecting. To yourself. To life. To the parts of you that still want to thrive. If this message resonated with you, don't keep it to yourself. Share it. With a parent. A friend. A caregiver. Because one small habit could prevent one big problem. This is Dr. Rao reminding you that every day is a fresh start. Clean up. Breathe deep. And keep choosing life one simple step at a time. I'll see you in the next video.